Hello everybody. It's been a great conversation so far today. I've really enjoyed being here. I was asked to come and talk about the role of innovation and digital technology in healthcare, and it made me pose a question to myself really. What if the NHS was like the rest of my life? What would it be like? Because at the moment I still get letters telling me to turn up at a certain time and place, and if I can't, not to bother coming back, or in capital letters to ring up and tell them why I can't come and explain myself. So it feels like there's quite a lot to do. So I'm going to talk a bit about that, if that's okay. I'll start with who am I? So I'm Rob Webster, Chief Exec of South West Yorkshire Partnership NHS Foundation Trust, or SWIFT for short. So I'm a Trust Chief Executive. I also lead the West Yorkshire Sustainability and Transformation Plan, which I think is quite important at this juncture. Some of the earlier conversations today referenced STPs, and I'll do the same. I've been in healthcare for 26 years and seen some things change and improve significantly over that time, and we need to significantly improve in the future. I thought I'd start really just by talking about what's the dominant debate in health and care constantly, probably throughout my career, but increasingly over the last few years and definitely at the moment. It's always about the money. So these are headlines from this week. You know, Theresa May meeting allegedly with the leadership of the NHS to tell them there isn't any more money. So you're going to have to get on with it and make change happen. Now, we could get swamped by this debate on the money, and we could constantly ask for more money, but I think that's the wrong thing to do. And that's because when I was at the NHS Confederation, we did a piece of work that said, it's always difficult in health and care. There's always money problems. What are the issues that affect us now, which mean we have to change? And it boiled down to 7 things, which very quickly are people's needs today are different. That means we have to redesign care. That takes leadership. That leadership has to be in the system and as well as your organisation. We need a different culture, one that embraces staff within the organisation and sees people as assets rather than as problems. That means the workforce has got to be different, working across boundaries, more generalist and more specialist. We have to embrace technology for the 21st century, and we have to manage the money. And the reason I labour that is because if we had all the money in the world, we'd still have to sort out the fact that people's needs are different. We have to change care. That takes leadership, changing culture, different workforce, and technology. Now, I thought about doing what I saw happen in Liverpool recently, which was somebody brought a fax on the stage and smashed it up as a visible symbol of the kind of changes that we need to make. I'm not going to do that, but we can't be the organisation that keeps the fax industry alive. We've got to embrace technology like it's the 21st century. And if somebody tells me a telephone consultation is an innovation using modern technology, I'll point out to them that's a 19th century invention. If we think that's the state of technology, we're in trouble. So STPs, our STP in West Yorkshire covers 2.5 million people, give or take, spends close to £5 billion, or will do by 2021, and encompasses a huge number of organisations, including care homes, including hospitals, including domiciliary care providers, including thousands of third sector providers. And what we're trying to do with the Sustainability and Transformation Plan is answer 3 simple questions. How do we close the health gap so that where you live doesn't define how well you'll be and how long you'll live? How do we manage the care gap because it varies too much? So half of people over 65 feel that they don't get enough social contact, for example. And how do we close the financial gap? And in thinking about that, we always end up talking about the money. And the money's important, but it's not the thing. It's one of the 7 things. We have to sort the money out, but we'll only sort the money out if we sort the other stuff out. And in West Yorkshire, we've got 6 places: Calderdale, Kirklees, Wakefield, Bradford, Leeds and Harrogate, for the purpose of NHS planning, is in West Yorkshire. Each of those places has been working on a plan that makes sense for their population. So our plan is just created from the local plans, which themselves have been developed over the last few years and include technological developments, innovation, and so on. And at West Yorkshire level, there's only 3 tests for whether we do something at that level or not. Everything gets done at a local level unless it passes one of 3 tests. First one, scale. So Leeds famously does hand transplantation. Now, you won't do that anywhere else. You're going to have to buy it at West Yorkshire level. Second test is somebody really good at it, and should we just copy? And then the third test is, do we not know what to do, so we're going to have to work it out together. And on that basis, because of good practice and not quite knowing what to do, digital as an enabler is something that we're doing across West Yorkshire, including innovation. Now, in doing that, there's something quite important, because the national narrative, the national debate, the thing you hear on the news, the thing that just made me cringe over the last few weeks was that this is about hospital closures. It's not about hospital closures. This programme is about how you close these 3 gaps and how you do that by redesigning care to meet people's needs in the 21st century. And for me, there's something quite fundamental about that, which is we should stop focusing and obsessing about buildings and organisations, start recognising that we're a guest in people's lives. And instead of expecting them to bend to our will as organisations, what we should do is say, what is it that you need in your life that's going to help you deliver the things that you want? And if we do that, those thousands of organisations that work together in West Yorkshire to deliver care can do so in a way that's better and probably simpler and probably more cost-effective. Now, I thought it was really interesting, the session from Scotland this morning, when they talked about their vision, said it's the same everywhere, and I think it is. If you look at the 6 boroughs in West Yorkshire that come up with their plan, and you boil it down to a few simple things, what everybody says is the same. We want places to be healthy, so they're child-friendly and you age well. If you've got a long-term condition, you'll be supported to self-care using technology and peer support. If you're older or frail or have a number of things wrong with you, you'll have a team that's based around you. You'll be in the team, your carer will be in the team, your family will be in the team, the third sector will be in the team, social care will be in the team, the NHS will be in the team, but there'll be a team which will be delivering the outcomes that you want. When you get sick, because you inevitably will, if you're frail, you'll go to a local hospital, which will be networked with other ones to be sustainable clinically and financially. Sometimes you might have to go further away to a centre of excellence, which will save your life and make sure that the outcomes you get are really good ones. And all of that will be commissioned by councils and the NHS together and fully engaged with local people. That's what it says. It takes about 600 pages to say it, but that's what it says. And I guess if you read every document, they just say the same thing. Now, if you think about the digital space and the fact that the future's here, it's just not evenly distributed, at each of those levels in West Yorkshire, I could point you to something where innovation and technology is being used to make a difference. So for public health and prevention and healthy places, in Wakefield, the Vanguard does a competition with schools for the kids to develop an app. It then goes to a Dragon's Den, including Microsoft. The kids then go to Microsoft and develop the app, and it's used. The first winner was something called Dragon in the Attic, which is a game which helps you understand about bullying and mental health. It's fantastic. You can get it off the Android store or iTunes or anything. I'd suggest you use it. It's great. Health Habitat, which is hosted by Leeds and York Partnership Foundation Trust, has developed a peer support platform for people with post-traumatic stress disorder, which is freely available to anybody and can be tailored to other service user groups. So technology delivering peer support. Joined up care is facilitated by understanding what's on offer. In Leeds, you can look at the Leeds directory, which tells you who can come and cut your hedge or who can treat your podiatry needs and everything in between, rated by people locally, assured by the council and others, and designed by the third sector to be interactive and easy to use. If you've got dementia and you're in a care home in Craven, then you will be, if you need an assessment by the hospital, that'll be done over a telemedicine hub using the finest technology, so you don't have to move out of your care home and your dementia be affected by being in a different environment, and it take you 3 days to get sorted out. I could go on. But what we've got in West Yorkshire, I think, is great examples of people doing things using innovation to change the way we deliver care. So across West Yorkshire, what we're saying is we should do 3 things. Secondary care providers should have IT that works, and they should be more mature. We should be able to share information across all platforms, and citizens, carers, service users should have digital technologies to manage their health and well-being. So it sounds simple, that's what we want to do. It should help drive changes in care, because we have to recognise we're a guest in people's lives. I was talking to someone who's speaking tomorrow earlier. She said her mum's sight's starting to go, so she uses Siri to help her navigate the streets, because it tells you how far things are apart and where to walk. As Molly said this morning, that's a freely available app, which is just designed to help support you. It's not designed for that, but people use it. So if we're a guest in people's lives, we need to recognise that's what's going on. And one of the things that we're trying to keep hold of, and I think we must keep hold of, is the power of local, the power of place, the power of communities, the power of people. If any of you are in West Yorkshire shortly, I'd suggest you try and get to the People Driven Digital Conference. It's one of the most inspiring things I've ever been to, where individuals who have invented bits of kit or improvements talk to developers about how they make it work and go to market. So I first came across this when Michael Serres, who'd had a bowel transplant, talked about what it was like waking up in the night covered in his own feces and how he didn't want that to happen anymore. And he talked to people about, well, how do I get it understood that my bag's filling up? There wasn't anything that would do that for him. He realised that he could put a sensor on the bag which would ring his mobile phone when it got to a certain level, which he then could change his bag, retain his dignity, and he'd be okay. It's now available to market. So people will drive change irrespective of whether we think it's the right thing or not. And what we've got to do is create the environment for that to happen. So I could point you to things in Leeds, I could point to things we're doing with the Academic Health Science Network, I could point you to the digital citizen work we're doing. But fundamentally, what we're trying to do across West Yorkshire and what we must do across the system is to recognise there are assets available to us if we'd only reach out and embrace them. I think that's been the theme of the conference so far. So in my trust, that's what we're trying to do, and we're not where we need to be yet. We have a digital strategy which we co-produce with people, which starts with digitally included patients and families, digitally enabled practitioners, digitally enabled services, and a set of things which are accessible, consistent, safe, iterative, co-designed with partnership. I think the thing I'm saying to you, if you're from industry, is that organisations are getting on with this in a context where it has to happen. It might not be the first thing that people think about, but it's certainly something that's got to happen if we're going to have sustainable services for the future. Now, the last thing I'd say is that if we're going to be successful in this, I agree with most of the speakers this morning who said this is a leadership task. And I think David from the Housing Federation said that this is a leadership task where trusts have got a leadership role and health authorities have got a leadership role and councils have got a leadership role. I'd say everybody's got a leadership role at all levels. There are different people who can bring leadership and assets to this. Now, one of the questions for me is, what do you mean by leadership? And I use a definition which I was gifted in 2014 by somebody when I had to talk about this as the Chief Executive of the NHS Confederation. And I had a room like this with about 1,500 people in it, of NHS leaders, chairs and chief executives. And I was talking about the importance of leadership. So I thought, well, I could ask a professor of leadership, like Michael Webster, to tell me what's the definition of leadership. I could ask the Leadership Academy, but I didn't ask the patient. I said, can you tell me what you think leadership is defined as in the health and care system? Because we're going to need strong leadership if we're going to make the changes that face us. And this patient wrote me a poem, which was pretty good, and I'll read it to you, because I think it's a great definition of leadership. What it says is, this rhyme is a puzzle, as you will see. This rhyme tells you what a good leader should be. A good leader respects the young and the old. A good leader observes and is prepared to be bold. A leader is brave and will try something new. A leader works hard and gives praise when it's due. A good leader expects the best from all staff. A good leader brings happiness and shares in a laugh. A good leader supports patients and gives them the best. A good leader teaches staff to be ahead of the rest. A good leader explains if something goes amiss. A good leader rejoices in times of great bliss. If you study this rhyme and look very close, you'll discover the leader I admire most. Now, That was written for me by Adam Borgelian, who at the time was 14. And I met him on Twitter. So he was digitally enabled, if you like, to communicate with others. And he communicates by blinking, or he did communicate by blinking because he sadly passed away. He demonstrates for me the power of understanding that everybody has assets that they can bring. If a 14-year-old boy can write a poem about NHS leadership based on his experiences where he's had half of his life in hospital, which is subsequently used by the Leadership Academy as one of their core texts in the NHS and organisations around the system, what could happen if we recognised what's in front of us in terms of the assets of people that we deal with every day, and if we decided that the NHS should be much more like the rest of our lives? Thank you.